We are really excited here to introduce to all of you students the I Am ALS Community Outreach Team. They're a patient-led organization that provides resources, education, and help for those living with ALS. And one of their goals is to host panel discussions with various organizations to raise awareness of ALS and to talk about the challenges of navigating and living with ALS. I'm going to turn it over to Kathy Collett, who will lead the presentation and discussion tonight. So Kathy, I'll pass it to you.
Thank you so much, Cindy, and thanks to everybody for being here and for having us here. This is a real labor of love. We'll go around our group real quickly and just introduce ourselves. I'm Kathy Collett. I'm in Indianapolis, Indiana. We lost Mom to ALS 26 years ago. And unfortunately, there are a lot of things in the world of ALS that haven't changed much since then. So we can talk about tonight some of the differences between 26 years ago and now, and some of the things that are unfortunately the same. I'm going to make, he's not a panelist tonight, but I also want to introduce Tim Lowrey, who's on listening to us tonight. These panels were his idea, and we actually have TLP on our t-shirts here, Tim Lowrey Panels. It's the Tim Lowrey Panel series, and then we reach out to school groups, civic groups. If there's a group of people who have a club or an employment place where somebody's with ALS, and we talk to them. So we can talk to a lot of different kinds of people about the actual experience of living with ALS. So I don't know, is Bob on the?
I am, yeah.
Bob, how about you introduce yourself, please?
Okay, hello, I'm Bob Scannell. My wife passed away from ALS just slightly more than a year ago. I was her full-time caregiver, and we certainly spent a lot of time with PT and OT at two clinics, Mayo and Duke, and some outpatient OT, and also some in-home. So I hope to be able to share some of those experiences with you. And I would say that we wouldn't have made it through all of it without PT and OT. So thank you for what you're doing.
Thanks so much, Bob. Caroline?
Hi, I'm Caroline Treadway. I am just north of Manhattan, and my sister Nell had ALS, limb onset ALS. She was diagnosed in 2009. She passed away in 2017. Nell opted to go the entire intervention route. She had a feeding tube, she was on a ventilator, but regardless of that, she lived life to the absolute fullest. The mother of 3 sons, and we had quite the house. We had the occupational therapists coming in, the PT guides coming in. It was quite the whirlwind. But like Bob said, boy, we thank you for what you're doing.
Thanks so much, Caroline, and we'll look forward to hearing more about the specifics of that. So, Jim?
Good evening, all. I'm Jim Pluzogan. I live in Charlottesville, Virginia. I am a recently retired pediatrician. A good part of my career was taking care of children with medical complexity and disability. So I work very closely with OT, pediatric PT and OT, and that was just really a rewarding part of my career. I developed ALS about a year ago, which prompted a rapid retirement. Tonight, I will be speaking as a patient with ALS.
Thank you, Jim, and we're so fortunate to have you on this panel, so thanks very much. Shelley?
Hi, thanks for being here today. I'm a U.S. Navy veteran, was diagnosed at 47, and have been living with ALS for 10 years. Did you know that veterans are 2 to 10 times more likely to be diagnosed with ALS than the civilian population? The VA presumes ALS is a 100% service-connected disease and provides all of my equipment and care. I'm very grateful for that. My ALS started in my left hip over 10 years ago. I had tracheostomy and PEG surgeries 15 months ago. I'm actually very healthy except for my stupid motor neurons. I've had both helpful and not so helpful experience with PTS and OTS. I'm happy to share them with you tonight. I use a Tobii Dynabox for everything, including driving my power wheelchair. I've published 2 novels, lobbied Congress, participated in other advocacy efforts, and, most importantly, I watch YouTube videos with my grandkids.
Thanks, Shelley. And Shelley's a wonderful example of leading a meaningful and productive life despite the ALS. So thank you, Shelley. Jackie?
Yeah, I'm sorry I can't get my video up there, but oh, are we okay? I kind of have a little different perspective. I'm an occupational therapy assistant with many years experience. And I have worked with about 10 ALS patients over my career. So I have a different kind of perspective because being in the field, and then my husband was diagnosed with ALS in January of 2020, and unfortunately had a very rapid progression of his disease and passed away like 9 months later. So I can give you some different perspective on how I dealt with it and how it all happened.
Thanks, Jackie. Thanks very much. And is Gia on the line yet?
I am.
Hey, Gia, how about introduce yourself? Gia's our chat monitor tonight. She'll keep an eye on the chat and make sure that anybody who's chatting in with their Tobii is heard. So Gia, thank you.
Oh, you're welcome. Thanks. So if anyone wants to type anything into the chat, I'll be the one politely interrupting to speak out what you have to say. My name is Gia. I live in Cleveland, Ohio. My father was diagnosed in May of 2021. He passed away November 29th, 2022. I was his full-time caregiver. I moved home from Washington, D.C. to take care of him. Got this lovely place with a first floor bedroom and bath for him. I won't be joining in too much because there's a ton of great expertise on the panel. OT and PT were really helpful for him at the beginning. It was towards the end when it felt like it was more of like a lost cause for him. He just kind of got frustrated with it. So we kind of had a mixed bag experience with it. But regardless, anyone in the healthcare profession, kudos to you. Thank you for everything that you do. And thank you to everyone here. Tim did say in the chat that looks like we're going to have a big crowd. Thank you all for coming if no one read that earlier.
Thank you very much, Gia. Thank you. And I'm in present mode, so I can't see the chat. So you're on and you're not interrupting. A friend with ALS taught me that. She said, it's just being in Zoom meetings is wonderful because it makes a lot of meetings accessible. But she said, when you put something in the chat and your chat comment is just left there, she said, it's just really frustrating. So it's not interrupting at all. And that's why we have a chat monitor. And I appreciate you doing that. So I'm going to take you through a very quick ALS 101 with some slides. I'll probably leave more questions with you than I answer, but we'll have lots of time at the end for Q&A. So I'll go ahead and get started. And these are actually some real families dealing with ALS today. ALS, what is it? Well, I'm going to give you the non-scientific definition that I think is pretty intuitive. Your brain tells your muscles what to do. And in the process, the motor neurons deliver the messages from the brains to the muscles. So you folks probably know all about this, but the motor neurons are there. They're the messengers that get those signals to the muscles. And in ALS, the motor neurons start to fail and die. So the messages from the brain are not making it to the muscles. And eventually those muscles weaken, they start to twitch and they waste away. And eventually there's just a loss of these voluntary muscles. No known cures, no treatments that actually reverse the disease. How's it diagnosed? It's typically a process of elimination. No physician wants to tell a person you have ALS. So they look at all kinds of different things. There's no definitive test. It's not like they can give you a blood test or do an MRI and say you have ALS. That's not it at all. They do a combination of things to rule out other diseases. Genetic testing is also important. 26 years ago, when my mom was sick, they didn't even talk about that. And today they have found a number of genes that are both associated with ALS and some that are actually causative. And in about 10% of cases, there are these family histories where there's a known genetic mutation in a family that it just terrorizes families, it causes familial cases of the disease. So we pay much more attention to that in genetics than ever had been done in the past. Early symptoms, how does it start? Well, it starts different in everybody. Everybody on our panel will have a different story about how the ALS started or how they first noticed it. Sometimes it's muscles twitching, and they can be twitching in your arms and legs or in your shoulders or even in your tongue. You get these fasciculations in your tongue. Muscles cramp. Some people get their muscles start to cramp up and they get tightness. They get muscle weakness. That's how Lou Gehrig figured out something was wrong. He was having muscle weakness in his arms and he wasn't hitting well. Before he even felt sick, he knew something was wrong. Slurred and nasal speech, and sometimes slurred speech is, if you can imagine, it's a real problem. When my mom's speech started to slur, that's when we knew she had to get to the doctor, that there was something wrong. But people in the workplace sometimes with slurred speech, that gets blamed on perhaps what they were drinking for lunch, and they aren't diagnosed right away. Difficulty chewing and swallowing is not unusual. And people, they'll choke. They'll typically, that you get the coughing spell and say, oh, there must have been too much vinegar in the salad dressing. And actually it was the swallowing and chewing difficulty. And excess saliva is also very typical. If it starts in your arms and legs, it's called limb onset. If it starts in speech and swallowing, it's called bulbar onset. And typically bulbar onset has a worse prognosis, but none of the prognoses are good. Progression, most people die when it gets to their respiratory muscles and they're unable to breathe well. The symptoms and progression vary so much though, and we use the unscientific terms. Some people have fast cases and some people have slow cases. My mom had a very fast case. There are other people who it seems like the drop off is slower, but the weakness and atrophy spread. I mean, the disease, it keeps going. You'll see some charts on this about early stages. Early stages, you may be able to function pretty well. Middle stages, you start needing the assistive devices. You need the walkers and the canes and the braces, et cetera. And then in late stages, you're ready for the full technology. A good power wheelchair is just essential for most people. And the technology that enables the communication, et cetera. To give you an idea of timelines, and of course these timelines vary, it's 50% of the people who are diagnosed die within 3 years. 90% of them are gone in 5 years. Yet 10% live 10 years or longer. So it's hard to predict the progression of the disease. Some facts about ALS. Over 6,000 people are diagnosed in the United States every year. That's about as many as are diagnosed with MS. It's a lot. There are an estimated 32,000 Americans living with ALS at any time. That's not very many. That's far fewer than are alive with MS, because the world of MS, as difficult as that disease is, they have some treatments that at least give people a much fuller life expectancy. People with ALS, their life expectancy isn't very good, and there are only 32,000 of them living at any moment in time. Lifetime risk is an important number to us. Lifetime risk is 1 in 300. That means if you're in a graduating class of 1,200 people, 4 of those people will at some time in their lives hear a doctor say you have ALS, and that should get all of our attention, I think. Military vets are twice as likely to have ALS as the general public. The reasons are not known. There are studies going on to try to figure that out, but it's a terrible thought. And ALS is a presumptive disability. If somebody's diagnosed with ALS and they've served in the military, it's presumptive military disability. An interesting fact and an important one is that people with ALS burn calories faster. They're hypermetabolic. And people with ALS do better if they keep the weight on. So it's really important that they get the calories in. But you can imagine in a disease that affects your swallowing and that affects your hand. I mean, it's hard. It's really hard for a self-sufficient adult to go to a restaurant and ask somebody to cut their dinner up for them. And that's literally what a lot of people with ALS have to do. As a result, some people aren't eating the way they should be. And it's really important that people keep the weight on and eat well. So and feeding tubes are something that are a really important intervention for people with ALS. Researchers are investigating toxic substances, diet, viruses, and physical trauma, head trauma, all kinds of things to try to figure out the potential causes. Conventional wisdom is some combination of genetics and triggers, but they don't know what they are yet. This is our timeline. Lou Gehrig died in 1941. In 1995, a drug called riluzole was approved by the FDA. By a French company. It was believed to reduce motor neuron damage and slowed the disease down. It showed in studies, slowed it down by maybe 3 months. So maybe it could buy you 3 months. So that's pretty good. I mean, considering the alternative, and we were all glad to have riluzole. My mom took riluzole 26 years ago. It's been kind of a sparse bunch of drugs since then. Edaravone, which was an old stroke drug from a Japanese company, was approved in 2017. Again, it's not a cure, slows the decline down by a few months though. Always glad to have those drugs. And finally, late last year, we had another new one come on the scene. It's called Relyvrio. And you may have read about it. 2 students from Brown University thought it up. And it's a combination of 2 existing products, and it was just approved. But it's another one of those slows the disease down a little, but certainly does not change the overall trajectory of the disease. Talking to physical therapists and occupational therapists, care plans are important, and it's really most people with ALS. Try to get to some kind of an interdisciplinary team so that these care plans can pull in the different healthcare professions that are needed to deal with ALS. An important thing in ALS is that when you do physical therapy for a person with ALS, is I don't have ALS. So when my orthopedic surgeon wanted physical therapy for my knee, his goal was to make my knee well. That's not the goal of physical therapy with ALS. The goal is to make things as best as they can be and to preserve as much function as they can, but realizing that the ALS path is a downhill path. But Medicare will still pay for physical therapy. It doesn't have to be that you can restore anything. It just has to be that it will make people as good as they can be. Exercises. The kinds of things that we do, the big things that I hear people with ALS talk about, how important the stretching and the range of motion are so helpful to them. And I had an old friend with ALS who lived in Florida, and he lasted a long time with ALS, and his 2 things were he kept the weight on, and he had a physical therapist who came in several times a week to help with just keeping range of motion and keeping him from becoming crampy and stiff. So really important stuff. And the others on this panel can talk to you more about those kinds of exercises that are so helpful to people with ALS. Equipment is an important advantage that people with ALS have, especially with today's technology. The gentleman in that picture there, if you're a football fan, that's Steve Gleason, former New Orleans Saint, the fellow who famously blocked the punt when Atlanta punted the first game after Hurricane Katrina, when they opened up the dome in New Orleans again. Steve has ALS, but he is also a real leader in technology that helps people with ALS, and having the right equipment that is enabling and letting people lead very full and meaningful lives. Braces are important. My mom had terrible neck weakness, and a good neck brace was just a lifesaver for her. As the disease progresses, gravity is not your friend with ALS. Help with transfers and Hoyer lifts, et cetera, all become important. And being able to have accessible bathrooms, and you work with what you have in your house, and it's amazing what some clever people can do to make those bathrooms more accessible and usable for people with ALS. And then the power wheelchairs, which I prefer to call fall prevention devices, are just so important. And for people, they can move around on their own. It gives them some independence, and then it's a comfortable place to sit. The new power wheelchairs have adjustments so that it helps avoid some of those pressure sores that are so terrible. That's my 101. We have some discussion points we'll go around and discuss within the group here, and then at the end of that we'll have time for questions. And as you think of questions, please don't hesitate to ask questions at the end. We're very open to any question. No question needs to be uncomfortable. We want you to understand more things about ALS. So I'm going to ask the panel, though, the first question here. When you first figured out something was wrong, what were your first symptoms? What was your first clue? And what was your path to diagnosis like? Any of the panelists want to start?
I can start. Like I said, my husband was diagnosed with ALS. And really, like in January, we doctor hopped. What happened was he went for an endoscopy. And that night, when his ALS started, that triggered his ALS. So he started with kind of a slurred speech, and then he started having swallowing problems that very night. And I immediately called the doctor the next day and said, what happened during that endoscopy? Because he's having some terrible problems. The doctor said nothing. So that started our doctor hopping, because we went to his family doctor. We went to two neurologists. Nobody could figure out what was going on with him. Then the pandemic, then the COVID started, and everything shut down. And he started progressing so fast in that time, and I was in a panic because somebody needs to see him. We need to get this guy seen. Something happened. We went for, finally his family doctor said, go for speech therapy. Well, for what? What's his diagnosis? Well, I don't know, but just go to speech therapy. So we go to speech therapy, and she knew on that first visit what was wrong with him. I didn't even know. So she said, can I send you to one more doctor? Listen, we'll go anywhere. So we went to this one doctor, another neurologist, and that's when we got the diagnosis that, yes, indeed, this is ALS. And I just couldn't believe, we couldn't believe it. When I really looked at his body, then I could see problems. I could see the fasciculations in his arm, and I never really noticed them in his trunk. He was doing, he's, like I said, we started having to do swallowing, his food had to start to be pureed. He was still walking. He was still driving. He could still do all those functional things. He just lost it from the neck up, basically. Then one day he took the dog to go to the pet store, and I get a phone call on his phone, and it's the police. And they're like, you need to come get your husband and the dog. We've called an ambulance. Well, what caused that? So I go there. He face planted, getting out of the car. That's when he lost his legs, literally stepping out of the car. And the first thing the policeman asked me is, does he drink? Does he always talk like this? And I said, yes, he has ALS. But they really thought because he lost his balance and he has slurred speech that obviously he was drinking or something to that effect. And that started our life with ALS. We started having renovations done on the house. We had, like Kathy said, trying to organize, get a wheel-in shower. He was, things you have to think about is now all of a sudden it's a loss of an income. How am I going to take care of him and still work? Fortunately, I had a friend who was a CNA who literally quit her job when she found out that he had ALS and I needed help, and came and I basically hired her, and she took care of him during the day so I could work still. Like Kathy said, important things: stretching, range of motion, positioning. The other thing I'd like to let you guys know is, being a therapist, a lot of insurance, what you have to be careful of is a lot of insurances will only pay for so much equipment. So when you're looking at equipment, look at what they can afford now. Maybe they can afford a cane or a walker, because later on they might need, let's say a wheelchair, a regular wheel. Get them if they can afford to buy that now, because maybe later on they're going to need a power chair. And if it's within 3 to 5 years, insurance won't pay for another one. So save their money to buy the things that they need later on in that time frame.
Thanks, Jackie. Thank you. Those are fabulous insights, and your story about taking a while to get diagnosed and going down some odd paths is not unusual.
Because people just didn't know.
Yeah. Shelley has in the chat, her first symptoms included staggering and falling. It was like I had 3 glasses of wine. I went to the doctor after a particularly bad fall while on a morning run. After a year of diagnostics, I remember hoping for an MS diagnosis. 4 different neurologists dismissed my symptoms. Finally, one took me seriously. And my mom's story, when Jackie talked about the speech therapist, my mom had been misdiagnosed as my mom was older, as having had some small strokes, and the arthritis in her neck was supposedly what was causing her head drop. So she went to speech therapy for 6 months, and her speech therapist was the one who knew what it was, and called me and said, get her to a good neurologist. And we did that. And then a good neurologist knew what it was right away. So it's difficult. And sometimes by the time you folks in speech therapy or in physical therapy and occupational therapy get somebody, they're well into the disease. Caroline, do you have a?
Yes, my video just went off. My sister was a almost Olympic caliber rider. She did eventing, which was the full gambit. She did the cross country, the stadium, the dressage. And she, during competitions, would complain that she couldn't stay on the horse. Her legs weren't working the way they usually did. So that was her first clue that there was something wrong. Then it was the right foot, the drop foot. She also had the twitching. She, though, had a couple red herrings that popped up during her diagnosis. When she was in high school, she was on the diving team, dove into somebody who wasn't supposed to be there and broke her neck. Recovered terrific from that, but that lingered. And when that was brought up to doctors, the doctors thought, well, geez, maybe it's that, blah, blah, blah. So anyways, it took us a while to get her diagnosed. When she finally was, it was limb onset diagnosis.
Thank you, Caroline. Anybody else have a story about how it started and
My dad actually, he had he had a comorbidity with ALS that it got kind of swept under the rug. So he had something called, and I'm going to butcher this, so half of you will not know even what I'm talking about. But it was like Dupuytren's contracture, where it affects, you might know, the OTs might know this, where it affects these two fingers in your hand. It's a calcification here. So he had a really very extensive hand surgery in 2020. Prior to him being diagnosed, he had about, I don't know, like 24 sutures put in, and it was scar tissue and calcification here. And it's actually what made his pinky finger crooked, which my pinky finger is extremely crooked too. So I may have it. But that was like my sign that I was my dad's daughter. But it was after, once he had the surgery in March of 2019. In April of 2019, he got the sutures removed and his grip and grasp never regained. And in May of 2019 is when he was diagnosed with ALS. And it was odd because you don't put much emphasis on hand surgery. I mean, I'm not trying to downplay it, but it's his hand, it's his two fingers, it's nothing crazy. So to go from, I have stitches in my hand, I have like scar tissue or calcification, to I have a neurological disease that's untreated, that is, it's going to kill me, was horrifying. So I just wanted to share that.
Thanks, G. And boy, when people are diagnosed, that what you just said is it's a handful to take in. I mean, because you're not only finding out what these odd things that your body has been doing but you're getting a horrible prognosis, and that's a lot to deal with. And I think that medicine is getting smarter and smarter about people with ALS sometimes needing some help dealing with the mental aspects of this disease, because it's a lot to deal with. And those aspects of the disease are handled differently. No two people handle them quite the same. But I think that there's some remarkable people with ALS who are able to handle some of those, a good mental health while they're dealing with such a crummy disease. Any of my friends here have ways that they go at it to keep a good out.
I'll read in the chat. Shelley shared that the mental and emotional journey is often more difficult than the physical challenges. I feel like I have an advanced degree in processing grief. Gratitude has been key for me in finding joy and staying engaged in life.
Thank you, Shelley. That's pretty awesome. I'm just always amazed at the strength that people with ALS have as they deal with it. But boy, you've got to be strong to deal with that kind of a diagnosis for sure. Anything else?
I can chime in here, Kathy, if that would be okay.
Please.
Great. So just back to the diagnosis, being a physician, married to a physician, at a center where there is an ALS Center of Excellence, my story was a little different. The fasciculations were a tip-off early on, and as well as the hyperreflexia. And then I'm left-handed, and so I had very subtle changes in my left thumb that could have been easily discounted, but I sought medical attention from people that were thinking about this, as hard as it is to think about, especially in a colleague. And I got right to a neuromuscular neurologist who specializes in ALS, and I had EMG and MRIs done, and it was a very actually swift and positive experience in terms of getting the diagnosis and moving on into treatment in an interdisciplinary clinic, which followed quickly. So it's quite different, I think, probably because of the connections we have here at UVA. Having been on faculty, my wife still is on the faculty, so it's a little different. But as I've talked to so many people with ALS, the other stories that you've just heard are probably a lot more common. terms of coping or, the mental health aspect of it, I'll share that in my experience, ALS brings constant change in every domain of life and really requires constant adaptation. I probably confront something new every day that I need to adapt to or think about planning to adapt, to. So putting it another way, like Shelley said, ALS brings constant loss in basically every area of your life. That's sad. It's hard. It's hard for you all to hear. But it's the reality of ALS. And so loss brings grief, and, identifying that and really responding to that in our own lives is really important. So taking care of my mental and spiritual health is really, maintaining a sense of well-being has really been essential, even more essential now that I have ALS than just regular life, to continue living my life in a meaningful way, because life doesn't stop with ALS, of course. You just need to adapt. I would say if there are a couple things that have been really helpful to me, a daily contemplative practice has been really essential. And then some of my friends that have ALS have said this as well, kind of getting rid of, clearing out the stuff that doesn't bring me joy, the stuff that just, why am I doing this? Or why have I been hanging out with that person all this time? Jettisoning those things and making room for the stuff that I really do enjoy and love to do, and really taking that on with gusto has been really important. And then lastly, having meaningful work and a way to contribute, like we're doing tonight, I think serves a really important role for all of us with ALS. And it's one of the reasons why we're here with you tonight.
Jim, I have to follow that up. I'm so sorry, because that was so moving. And I just have to share kind of the other side of it. I hear people like Jim who speak, and it's just beautiful to me. It makes my heart just melt. Like what a gusto for life. My dad was the other side. And I'm sorry, Dad, to say this to you, because you were a very private man. My dad was like a meat and potatoes, coffee with cream and sugar, Price is Right, Jeopardy, same work boots he had worn his whole life. He was not a man who showed his emotion. He liked consistency. And he didn't show his true feelings. He was never going to have a journal. He loved God and he loved consistency. And when he first got diagnosed, I thought, this is going to spark change in him. He's going to become like, we're going to go on an adventure. We're going to go on a trip together. We never went on a trip together. Like, he's going to become like one with nature. What? My dad loved Pepsi and Lay's potato chips. We're not going to nature. What I learned was that my dad didn't want any more change. Like Jim said, like, you cope with so much grief and loss. My dad held on to every fixture that was a constant for him. And so he kind of put a little wall up and was like, no, these are the things you can't take. You can't take my Folgers coffee. You can't take my Wonder Bread. You can't take my Cheese Whiz. You can't take my chocolate ice cream, and you can't take my Jeopardy at 7:30 at night. And now in hindsight, I look back on that and I really love that he kept so many constants. And although I wanted him to be like a Tim Lowrey or a Jim and like super philosophical on life, and like my dad did it in his own way. So I think you also take into consideration that there's folks out there with ALS who maybe are very reserved and quiet because they're already vulnerable enough everywhere that they are, that they need something to keep to themselves.
Gia, thank you. I can relate. Thank you very much. My mom got Final Jeopardy her last night with us, so I get it.
Yeah. And Gia, thank you for saying that, because I grew up in Lorain, Ohio, right near Cleveland. My parents, like, I get it. Like, I totally get it. And I'll share that when I asked a close friend early on about how to just pursue, like, I was at sea and I was looking for language to describe what was happening. And he said to me, Jim, just be yourself. Just be yourself. And I think that's what it is. You know, these things are what come naturally to me and what I want to do and who I am. And I'm taking them on with gusto. And God love you for having, you know, getting your dad his Pepsi and his Lay's potato chips and sitting there and watching Jeopardy with him, because I'm sure that made him happy. And, you know, yeah, you didn't go to Paris with him, but, you know, all right.
I corresponded a long time ago with a nun who had ALS. I never met her in person, but I corresponded with her online, and a lovely person, but really in a difficult situation. And I made a comment once about the quality of the people who get this disease. It's amazing. I mean, they're good people who seem to get this disease. And she said, the disease strips you back to the basics. It lets a lot of the good come through and some of the bad. So there you go. That's I've always remembered that it strips you back to the basics. Let's talk a little bit about challenges, big challenges that stood out to you. Bob, do you have anything that comes to mind in terms of the big challenges that you face with ALS?
It seemed like, I think Jim made a comment earlier, it seemed like there was a new challenge every day. And that was kind of the issue. We'd get something tackled and then, you know, that solution no longer worked the next day. So that was really tough. And to put it in context of who we're talking to, I think one of the things that was most helpful is the more often we could get a refresh on things like OT, the better. You know, every 3 months at the clinic, frankly, wasn't enough because things were changing too quickly. And because there might be some generic solutions that work well for a large class of people, in reality, everybody's home is different. Everybody's emotions and pride are different, and their caregivers have different levels of strength and so on. So having an OT person come to the house, a PT person come to the house and really look at what was going on, that was extremely helpful.
Thank you. And boy, that whole idea of coming to the house is just, it makes a big difference when you have ALS. So that's a good thing. Jackie, anything come to mind? The big challenges, the big things that stick out like a sore thumb in the world of ALS?
I think just everyday life, like how are we as a family, with the kids? How are we going to all cope together? How do we take care of the kids too? Making sure that they're okay, the challenges of, once it got unsafe for him to walk the steps. Now we're rearranging the house to make it to accommodate for him, taking the couch out of the living room, putting a hospital bed in there, then turning the hospital bed so he could look out a window instead of staring at a wall. He did the same thing. He loved his Western movies, and I could walk in and I could almost verbatim say what they were going to say on television, because I've heard him so many times, but he loved to watch that. So I'm not going to change that. We had a tree taken down in the front yard, and it was fun for him to look out and watch them take this tree down after, because by then he was bedridden, and just little things like that. But the splinting, yes, make sure, you get the splinting done early in the treatment. Start working on the adaptions that need to be done in the house. Don't wait till it's too late. So those are a lot of the challenges we dealt with. And him still wanting, when in the early part of his disease, he still wanted to do what he could. He loved to cut the grass. And literally in the first, let's say June, the first week of June, he could cut the front, back, and side. The second week in June, he could not cut the back anymore. That's how much strength he lost. The third week, he could only cut the front yard. And by the fourth week, he couldn't cut the grass anymore. That's how fast he progressed. But he wanted to do what he could do up until he couldn't do it anymore. So that's important as a therapist, figure out what do they want to do and how can we make it happen?
I think finding out what's important to people is so key.
Correct.
You know, my mom asked me one day to help her button her blouse. She'd never asked me that before, so I helped her button her blouse. And she had really good grip strength, but she was losing her ability to do little things with her fingers. And when I did that, she said, "You know what the worst part is?" She said, "I know that when I lose the ability to do something, I'll never do it again." And she wanted independence. I mean, that was a hard thing for her. So I think it varies from person to person, but what's important to them is so important for the healthcare team to know. Gia?
I was going to read, Shelley had mentioned in the chat that grieving is the biggest struggle for me, what my life would have been, and grieving the loss of each function. Travel or simply navigating the grocery store are difficult in an often inaccessible world. Now that my arms and legs are merely decorative, the daily and weekly losses don't impact me as much anymore.
Thank you, Shelley. Thank you very much. Let's move on to just some specific. Do you have any anecdotes of physical therapy encounters that were particularly good or particularly bad, or how you were introduced to the topic?
Can I just say one thing that I wish was covered more? And maybe this is just as a daughter to a dad. The hardest thing for him and for me was when we crossed the bridge of toileting. And when I toileted my father for the final 2 months of his life. No one in my family had done it before. Only I was the one who could do it. Both 1 and 2. We were full-blown bedside commode, and I winged that. I look back and I wish someone had said, "You're doing this right. Hey, this is going to be hard. Hey, this is going to be harder for him than it is for you, but your struggle is still validated." Because I felt like a horrible daughter. When I dreaded hearing that ding dong that he was done. It wasn't pleasant, but I didn't know what I was doing. I didn't know if I was doing it right. I didn't know if I was irritating a sore. I didn't know, was I putting the right, I just wish that toileting was covered more. And I'm just going to leave it at that, because you know what I'm talking about. I just wish it was covered more.
Amen to that. I mean, I get that. I mean, and you have to realize you have families they've never done this stuff before, and you're trying to find your way through it. And in my case, my mom knew how to take care of everybody. I didn't, and it was like I was worried that I wasn't the caregiver that I was supposed to be. So yeah, thank you, Gia. Physical therapists. Any great physical therapists you've encountered?
Do you
I
want to
do
read
have
from
a
the
chat
chat?
comment
Yeah.
here. Shelley did say, "I was experiencing joint pain in my hips and shoulders. The PT came to my house and performed a range of motion exercises from my head to my toes. Then he taught my husband and caregivers how to do the exercises. My pain resolved within weeks. The PT comes back about every 6 months to update the exercises as needed. And this was a game changer for me. No more pain." I contrast that with a previous ALS clinic PT who gave me a generic handout. It wasn't helpful. I needed hands-on training for my caregivers.
Yeah.
And I'll mention an experience that a friend had with ALS, and she was experiencing pain, and they were talking to her about medicating and all this, and a physical therapist helped her with pillows, getting pillows in the right spots. And she was like, as long as she had her pillows in the right spots, she was good. But it was just, she was grateful that she found somebody who went down that path with her. Otherwise, because she didn't want to medicate, because to her, it was very important that she always have her head clear. And she didn't want to medicate too much. So the pillows were like a blessing. And you find things. You get pretty good at the Rube Goldberg solutions to problems, but that was a low-tech solution to a really serious problem for her.
Yeah, I mean, I had a frozen shoulder and as an early thing with ALS, because my left arm wasn't working as well. And so when I was sleeping, I had lost enough muscle tone around my shoulder that the joint wasn't sitting normally in my, in the socket. And so it developed pain. And then with the pain, I had limited range of motion. And with that, then it became frozen. And I went to a couple of PTs who didn't see the connection and sort of started with some stretching and stuff, and then got to a PT who really specialized with shoulders and understood the connection and did some deep fascial work along my shoulder and fixed it. And I'm telling you, it was terrific, because when you don't have to have pain on top of everything else, especially when you're trying to sleep, my sleep had gotten so disrupted by the pain at night with my shoulder. And the same thing, I didn't really want injections or pain medicine. So it was tremendous that this person, fixed things. And then with OT, I've developed a correspondence over the years, and it's one of the pleasures of my life. I correspond regularly with a number of people, and have enjoyed writing cursive, and sending letters. And it's just been a practice of mine that I've really enjoyed. And being left-handed, and with the ALS coming to my left hand, that was a really sad loss, that I wasn't able to write with my left hand anymore. I've learned to write with my right hand, but it's not the same. And I can't really do a whole cursive letter. But I went to an OT and said, I want to be able to write some things. And he took the time to understand why it was so important to me, that this correspondence was a really important part of my life and had been for decades. And so he fashioned a mold onto my favorite pen and developed a brace that I could use with my left hand. And I was able to carry on with writing for a while. I mean, it only worked for a couple of months, but it really made a huge difference to me that someone took that seriously and worked with me. I had to go back 2 or 3 times to get it right, but it really made a giant difference to me. And, you could you could look at it from the outside and say, oh, for God's sake, 3 OT appointments and braces and molds and everything for a couple of months of being able to write letters. But you know what? That was really important to me. And I really, really, really am grateful for that OT that took the time to listen to me and work with me on that.
Thank you, Jim. That's a wonderful story. And I think those things too are victories. When you find things that you can adapt and kind of outsmart the disease a little bit, that's a victory. And I think everything that an occupational therapist can do to help people with ALS, with devices and embraces and such, those victories can be really important. So thank you. How about, I know we're kind of coming down on time. Any caregiving stories? I wish we had a physical therapist who could teach you how to lift the patient. That was like, and I think if you had a regular physical therapist, that could be helpful, because as a caregiver, there are things that happen that I'm sure a good physical therapist could be of help with.
I will say that I was never shown because it wasn't deemed safe, but I think that there needs to be some understanding that I was my dad's sole caregiver, and I'm not saying that my family didn't come by during the days and help me like during lunch. Thank you. But like night times were really hard, and I lived here alone with my dad, and my dad had to pee during the night and had to shift. And no one ever showed me a safe way to transfer him or shift him solo, because he was deemed a 2-person transfer. And I'm 100 pounds and 5 foot tall. And I get that it's not safe, but I also don't have funds to have an overnight nurse with me. So I need to find there needed to be some bend with that on maybe showing me, like, I know that this isn't the textbook thing to do, but I need to find the safest alternative for what I've been dealt with. And I'm dealt with my father sleeping in a recliner and his daughter living alone with him from the hours of, like, I needed some help. I wish that. And then Shelley did say in the chat that my OT ensured I had all of my equipment before it was needed. We wanted to adopt equipment before we were in a crisis.
And in our case, Shelley, I told the doctor, it was like we were constantly throwing the ball 5 yards behind the receiver. We get something and it was like we were ready for the next thing. So, Bob, any wisdom for us?
A couple of things I think are useful to share. One, as far as the therapy itself, particularly the OT, I think if you can find a way to make it fun and less boring, and if there's kids in the family, involve them. And a couple of things that ours did that helped with range of motion. One was a very small badminton racket, extra small, light, and balloons, just air-filled balloons. And my wife and my daughter would hit them back and forth, and it was nice range of motion, change hands. And the other was a Velcroed kind of mitt and a tennis ball. And so again, range of motion, throwing, gripping. It was some nice therapy for my wife that was something fun to do with the kids. And the other thing when we went to therapy, there were two sessions, there were two halves to anything. One was doing the measurements, how strong, how many steps, how long does it take you to walk from one side of the room to the other? And then the other was more practical, what kind of problems are you having and so on. I would just suggest focus on the second one. If you have to do measurements, do them later, but they're very discouraging for ALS. I mean, they're not going to get better. They're always weakening. And what they really need is the advice. So.
Thank you, Bob. My mom would agree with you on that last one. So, anything else that you'd like to pass along to the students here before we open it up for the Q&A?
I think one thing, being a therapist myself, is that, going back to the positioning in bed and in the wheelchair, if you're working in a facility, let's say a long-term care facility where you have an ALS patient and you do bed positioning, make sure you do pictures, whether it's a hand-drawn picture, or if you can take a picture of the person in bed with whatever positioning devices, so that every night the person gets positioned that way. And I also write in the care plan that they must be turned and propped. They cannot stay on their back the whole time. You must turn and prop them to avoid any kind of bed sores. So that all gets posted either in their closet or by the bed, but it's also on their care plans.
After my dad had a his first and most horrifying fall was on a Friday night in September, and it was just the two of us here, per usual. All the horrible things happened when it was just me and him, and he was coming out of his recliner right here and took 2 steps with his rollator forward and went completely forward into the TV stand, which there's still a dent right there, face first. And I don't remember anything. It was horrifying. His BiPAP machine he was wearing, because he had to wear it 24/7, a clip broke off and I couldn't get the BiPAP back on. And because I couldn't get the BiPAP back on, he was deprived of breathing and he passed out, and the paramedics took him and we were rushed to the ER, and there was a crash cart that came in and they ushered me out. It was the horrifying experience you could imagine. And I had to, when he got moved to an LTAC, which I still to this day have guilt on, that if I would have been able to fix his BiPAP mask latch, this never would have happened. But a week later, we got moved to an LTAC, and I had to make a giant sign behind his bed that said, "Do not lay below a 45-degree angle." He could not breathe below a 45-degree, and everyone would just push the button down to transfer him. I was like, stop, he can't breathe, man. Stuff like that's super duper important. I don't know.
It's absolutely true. I mean, and when people with ALS need to go into a hospital setting, it's like they have to have a caregiver with them, just to make sure that these things that oftentimes healthcare professionals just don't realize don't happen to them, because it's a dangerous disease. We have in the Q&A a question: what advice do you have for us regarding better patient care? Has there been any other experiences in therapy that we wish were handled differently? And Shelley has a response. I think hands-on at home when mobility is limited as much as possible. Also, don't feel sorry for us. Don't say there's nothing I can do for you. Be encouraging and instead say something like, let's do all that we can to keep you flexible and mobile in the safest way possible. Also, especially as the person living with ALS becomes more dependent, include the caregiver wherever possible. If the caregiver isn't on board, the person living with ALS won't benefit. Very true. And I will offer kind of the mirror to that advice. When the person with ALS has speech that's very difficult to understand, we found my mom's speech was really difficult to understand. I could help translate, but it was very difficult to understand. We found in some healthcare settings that the healthcare person would talk to me and they really should be talking to her. You know, I had to tell them she was perfectly capable of making her own medical decisions. Her speech was just a little hard to understand. So it's like caregiver needs to be involved, but also if it's hard to understand the patient, don't forget that that person still, you know, mom had all her marbles. It was just her speech was difficult to understand. So
They don't lose their hearing. So you do not need to yell at them, because if one more person yelled at my dad, I'm like, he can hear you. He just can't say it. I'll say it for him.
Caroline?
I was going to say exactly the same thing. My sister had one of her therapists, absolute favorite, but we had to break him in, because when he walked in there the first time and he was going to do those range of motion exercises with her, he was screaming at her, you know, talking very, very loud. And she's this tiny little thing in a wheelchair. And she had on her Dynavox and let him have it. But, you know, I can hear you. I'm not deaf. And then, you know, and never underestimate the value of those range of motion exercises. I remember that Nell used to just sit in her wheelchair, and we would come up and try and help her. But boy, when a therapist got in there and really, you know, did from head to toe, she had the biggest smile on her face. She just loved it. Absolutely loved it.
I think that's a wonderful note for us to end on. And Cindy, we'll be glad to take questions.
So students, do any of you have any questions for the panel members? You can, once you start talking, you'll populate up to the front of everybody's screen. So if we're okay, just kind of going that way, I think that might be easier.
They could type if they want to type too, if they don't feel comfortable saying
Sure.
out loud, they're welcome
Sure.
to.
You bet. Thanks.
So ALS was kind of mentioned as like constant loss is what you guys were saying. Is there any way that ALS has positively impacted your lives, or any like positive experiences you've had?
This group. These people, I am ALS, yeah.
Vicki, it teaches you what's important. So that in that regard, it does. My others, anything positive that just jumps out at you?
My dad's ALS brought me home. I moved away in 2016 to Washington, DC, because I was a career-driven woman. And then my dad got declined really fast. I quit my job and got rid of my house and quit my relationship and quit my life and moved home. And now I'm surrounded by my family. I think it brings you back to go all the way back to what Jim said. It brings you back to the basics of who you are.
Thanks to you, Jim.
Yeah, I mean, this is a tricky question, you know, because there's some choice involved about how we respond to adversity in life in general. And people are different in terms of how that happens. And people are at different points in their life when ALS strikes. And there is enormous loss that is every day, all the time. The grief is heavy and constant. And, you know, life has adversity. And if you choose to continue to live your life with adversity, then wisdom comes. I mean, positive things happen and they're unexpected. A lot of people in the IMALS community talk about this group of people. I know that when Peggy and I were at sea with the first, you know, getting the diagnosis, like, what the hell? How is this going to work? Finding people at IMALS was just unbelievable because there are all these dynamic people that were living their lives. It's like, let me go. I've got something to say here. I can make a difference. And the story I can tell of experiencing ALS has power. I mean, yeah, I mean, talk to Shelley about going to Capitol Hill and lobbying people and, so, it can be really positive too. Kathy has been in this, all these people here have been doing this for a long time now, and it makes a big difference if you step into it. I will say too that my wife is a wisdom scholar. She's written a number of books on wisdom and medicine. And so we might have been a little primed for this, because she wrote a whole book about how you can respond to adversity and move toward wisdom. Not that, we really wanted to use the book this way, but there you go. So there are choices people can make when responding to adversity in life, not just ALS, that can be positive. And the one thing I would like to leave you with is ask people, like Shelley says, don't feel sorry for us. Say, what's bringing you joy these days? Or what have you learned from it? I love that question. That was so wonderful. What have you learned from ALS? How are things going, And the other thing I want to say as a doctor, I was a nurse before as a doctor, by the way, and then a nurse practitioner and now a doctor. Ask the hard question, if it comes to your mind, like, oh my God, how is Gia doing this at home with her dad? Like, how is she doing this? Like, be the bold person that just sort of finds a way to say, Gia, how are you doing this? Like, how does this work for you? And what do you need? And then Gia might say, well, if someone could show me how to turn him, I know it's not legal or whatever, but I'm there at night and I got to know how this happens and I don't. So you sometimes, as the student even, can use that curious question to say, ooh, what's going on here? And how can we be helpful?
Oh, Jim, that was really great to hear. I want to interject before Kathy moderates that Shelley said the gift is that you don't sweat the small stuff. Being versus doing is what's important.
And we have some more questions and specifics about what PT and OT could help you with, or others in healthcare. How can they advocate in healthcare? And I'm going to give you one that I think is hard. It sounds easy, but I think it's hard. When people have ALS, they can't wait. And I found that it was absurd in the healthcare. I'm a person, I was raised, you be polite, you wait your turn. People with ALS can't wait their turn. We can't wait 6 weeks for the appointment. We can't wait 8 weeks until we get a piece of equipment to start. It's like, and anything that a healthcare professional can do to get them to the front of the line. And I'm not trying to create privilege, but I'm trying to be practical here so that the patient that you're dealing with and the patient that you're helping is the one that's going to get the equipment, not, by the time that in 8 weeks, when the piece of equipment comes, it's going to be a completely different situation. So just don't make them wait. If there are ways that you can get them in quickly, get things dealt with quickly, I think that it's good for everybody, and it would be such a refreshing thing, because we really had trouble. I mean, it was the people who made the appointments were like controlling my life as a caregiver. And we needed to get things done much more quickly than healthcare delivery was able to deliver. So I will leave you with that one from me. Anybody else?
Not to get on a vaccination conversation, but I go right with you with the don't wait. But my dad was completely immobile. Like, I would have had to have physically lifted 150 pounds into my SUV to get him anywhere. It was very hard. And I called the Department of Health the first week of September to see if he could get his flu shot and his COVID booster because they had a home service. It took 3 weeks for them to return my call and then 2 more weeks after that to get him set up. And there were people at all these pharmacies that were getting like their flu shot and their COVID boosters. And my dad was like, Mr. Vaccination, like he had like everything under the sun. And he wanted this COVID booster and he wanted his flu vaccine. And I was like, okay, like I'll do it for you. But I mean, it took 6 weeks from start to finish. And I just feel like for someone who ultimately lost his life because of respiratory failure, I wish that that flu vaccine and that COVID booster could have been brought to him, I don't know, a little faster, like, because
Yep.
he couldn't wait.
You can't wait. I mean, and time is just, as a friend with ALS described it, you're living on the ALS clock and it's different. And the pace of the ALS clock is different from what you knew before. So we have, Tim's going to follow up with Sammy with some materials. And Shelley says debris not being able to scratch an itch is exasperating too. And I cannot imagine that. I just cannot imagine that, Shelley. So as I sit here squirming and scratching and everything, it's anything else? Any more questions? Cindy, did we cover things okay for you?
I think you all did an absolute amazing job and you deserve a virtual round of applause. So I just really want to thank you, Kathy and Tim and Bob and Jackie and Shelley and Carolyn and Jim and Gia for everything that you brought to the students and to us tonight, and just sharing yourselves, your story, your family story, and so much that we can learn from all of you. So thank you so much. This was wonderful.
Thanks, everybody.
Thank you.
Have a great night.
Thank you.
Right.